This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenni Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy!
And we're rolling, baby, rolling. The Berman Method podcast focused on treating problems and not symptoms. David against Goliath, where we are going against the corporate medical system because they do not have your best interests in heart. Big pharma especially, they are not interested at all in curation. They don't want cures. They want client retention. And we talk about this regularly because there's not a single pharmaceutical on the market that doesn't have at least one side effect that requires another pharmaceutical to treat that side effect, and so on and so forth. So we are against that. We, as in me, Dr. Jake Berman, and my lovely co-hosts, Jenni Berman, physician assistant certified, who is not with us today. Our schedules are not aligning at the moment. It is a hectic time for us right now as far as summer travel plans go and business things, where last week, Jenni was solo with you guys. Genetics, if you didn't get a chance to listen to it, please go back and listen to it because it is a good one. I was not with her for that episode because I was up in Michigan, Birmingham, Michigan, just outside of Detroit for our first annual Berman Golf Workshop. So I have, almost 10 of my golfers just happen to be from the same area up there in Michigan. And I didn't realize it till this past snowbird season. And that's when I was like, hey, why don't I come up there and do a summer workshop just to get you guys through till you come back down. And that's how that came to fruition. So I went up there and did a 2-day workshop with some of my golfers up there. And it was a ton of fun. Tell you what. It was nice to have a couple of nights without the humidity, actually have a fire outside in the summer. That was really crazy for me to comprehend that because you are not having a fire this time of year in Naples, that's for sure. But anyways, that's where I was last week, and that's when Jenni talked about genetics. Today, what I want to talk about is hip pain. We're going to combine hip and back pain into the same thing. I'm not going to talk about lumbar spine, though. So people that say that they have a herniated disc in their lumbar spine or a bulging disc in the lumbar spine, I'm going to do that next week. But what I am going to do is I'm going to talk about hip pain and back pain because majority of the time when you have a bad hip, it causes back pain. So the way that hip pathology usually presents itself is you either have back pain or knee pain. However, it disguises itself, hip pathology, hip problems disguises itself as back pain or knee pain, so you don't really understand that it's your hip causing your back pain. It's your hip causing your knee pain. So you go to the orthopedic and you get an x-ray of your knee, get an x-ray of your back, and of course it shows the normal degenerative changes that you should occur or should see on however old you are. And we start going down this rabbit hole of trying to chase these symptoms versus doing a really good objective analysis and saying, wait a minute, what's going on at the hip joint? Hip replacements and knee replacements are by far the most common joint replacements in the country, in America. And the thing that drives me nuts about this, and the reason why it's relevant, the reason why it drives me nuts is because here in America, we are far more accelerated or fast to replace a hip or a knee joint than any other country in the world. And the other thing that really is astounding, and this is a true stat or statistic, so you should look it up if you want to, the prevalence of hip replacements or the quote unquote need for hip replacement in third world countries is pretty much unheard of. Like, it is so rare for somebody in a third world country to quote unquote need a hip replacement that it just is mind boggling. Yet here in America, it's almost considered a normal part of aging. Well, at some point, you're going to wear these hips out and you're going to need them replaced. And this is one of the things that I wrote about in my first book, Treating Problems and Not Symptoms. If you don't have that book, make sure you get it. Go on Amazon. I think it's only $10 or $20 at the most, and it really outlines everything that we're going to be talking about here in MythBusters. The fact that people in third world countries don't require hip replacements, there's only one thing that is vastly different in the lives of people in third world countries than opposed or compared to us here in America in regards to physical activity. And it's the fact that usually people in third world countries are not sitting in chairs. They're squatting. Versus here in America, we're always sitting in chairs. We spend 16 hours a day sitting. Think about that. I've talked about this a bunch of times in the past, but really think about it. You get up out of bed, you wake up, you brush your teeth, and you sit down to eat breakfast. Then you get up, you walk to your car, and you sit in your car to drive to work. You get out of your car, you go to work, you sit at your desk until lunchtime. You get up from your desk, you walk to the kitchen or common area to get your lunch, then you sit to eat lunch. Then you walk back to your desk and you sit for the rest of the day. Then you get done with work, you walk to your car and you sit in your car to drive home. You get out of your car, you go home, you do some tasks around the house, and then you sit to eat dinner. You clean up, and then you go to the couch and you sit and you watch an hour to 3 hours. Actually, Americans on average watch 3 hours of TV a day. And then you get up, you brush your teeth, hopefully, and you go to bed. So if you do the math, you're really sitting 16 hours a day. That is insane. Nobody in third world countries sits for 16 hours a day because they don't sit, they squat. And it's not easy to squat for 16 hours because it requires muscles. It does not require muscles to sit your ass in a chair. It just doesn't. You sit there, you plop down, and the only real muscles you need to work are some neck and trunk muscles so that you don't fall forward onto your face. But besides that, you don't really have any core muscles working. Your glutes are not working. Your legs are not working. Compared to you pop a squat ass to grass just like a toddler does, just like Stella still can, and that requires work. Now think about it. If you had a squat, if you didn't have a chair for your entire day, how long do you think you could squat for? 30 seconds, maybe? Maybe you could do 30 seconds 20 times a day total. The rest of the time you'd be standing. If you were to stand all day, it would be almost impossible for you to require a hip replacement. You would have to work really, really hard to need to have a hip replacement. Because the reason why a hip needs to get replaced in the first place is because it gets a capsular pattern. And what that means is you lose certain ranges of your range of motion. One of the most important ranges that you lose is hip extension, meaning that your leg's ability to go behind you. So if you could picture your right leg right now, as you're walking, the longer you can keep your right foot on the ground before picking it up and swinging it through to take the next step, that's the farther back your leg can go behind you when you're walking. That's called hip extension. The number one measurement that I utilize to predict if you need a hip replacement or not is hip extension, meaning that when you come in for a hip problem, one of the first objective tests we do is have you lay face down and we assess hip extension. The vast majority of people that come into the office, they can't even get to neutral, meaning that their hips are stuck in flexion, so stuck relative forward to your spine and your pelvis. So if they can't even get to neutral, there's 0% chance they're going to get into extension. And that's what snowballs in the wrong direction and ultimately leads to somebody requiring a hip replacement, is because you keep losing more and more hip extension. So to come back full circle to what I was saying earlier, as far as standing, if you were to stand 16 hours a day, it would be darn near impossible for you to get to a point to where you needed a hip replacement. I mean, you would have to really try hard and stand in a really contorted way for you to require a hip replacement. That's a problem, right? I mean, there's two things right there that should be really resonating with you right now, where at the beginning of this episode, you might have thought that a hip replacement is inevitable. Well, it's not. I mean, if it was inevitable, then everybody would have to have a hip replacement. But there's a reason why there's certain people in their 80s, 90s, and even in their hundreds that still have all their own parts. And you have to backtrack and look at what did their life look like prior to now compared to yours. This is kind of along the lines of what Jenny was talking about last week with genetics. So many times we Americans, we lazy Americans, look at somebody 90 years old who can move and groove and dance around like they're 60, has all their own original parts, no joint replacements at all, and we say, oh, that's just good genetics. They got good genetics. I got shit genetics. They got good genetics. That's why I hurt so much and have to have replacements, and that's why they feel so good and can dance around. Bullshit. That is not the case. I mean, there could be a very small percentage that it attributes to, there's a reason why Michael Jordan and LeBron James and all these great athletes are the way they are, because they've got a slight edge genetically compared to the rest of us. Or I would say that there's a reason why, take Kobe Bryant, for example. He is on the same level as Michael Jordan and LeBron James, one of the greatest of all times. And every single day of practice, the first 20 minutes of practice, he would just focus on simple chest passing drills. So the basketball is in your chest, and you're doing a chest pass. It's one of the first things that you learn when you're trying to play basketball when you're 5 years old, 10 years old, when you're going to basketball practice. You're learning how to do a chest pass. Now here's Kobe Bryant in his 30s with however many rings that he's already won, national championships, and he's still practicing it every single day. The first thing you practice is a chest pass. So yeah, you can argue that genetically he's superior, but if you really know the history of him and how hard he worked his ass off. He worked harder than anybody else on the team, and that's why he rose up. He was willing to put in the work, so that's why he was one of the greatest. Same thing for these other people. You look at somebody in their 90s and they're moving like they're in their 60s and they have all their original parts. Ask them what their life is like. What are they doing? How active are they? How passive are they? How many hours a day do they sit versus how many hours a day do they stand? Are they walking regularly? Are they exercising? Are they squatting regularly? Seriously, when's the last time you tried to do a deep squat, ass to grass? You know, there's a lot of people listening to this right now where they're going, there is no way that I could squat down like a toddler, ass to grass. No way. I'd have to hold on to something or I'd fall over. Why aren't you practicing that? You should be doing that once a day. Once a day, ass to grass. Because if you do it once a day, there will never be a day that you can't do it. Oh, but that requires work. Oh, man. Yeah, I forgot that I'm just a lazy American. I'm not doing that. Screw it. I'll just get a hip replacement when it's time. Seriously, that's the thought process a lot of people have when it comes down to it. So coming back full circle, there are a lot of people who have a hip replacement very prematurely. And they think that because hip replacements are so common that it's no big deal. I have to have a hip replacement. It's not my fault. It's my hip's fault. It's my genetics fault. But it is a big deal because once you have a hip replacement, there's things that you will not do that you could have done if you had your original parts. Yes, hip replacements are getting better. And just FYI, if you are considering a hip replacement, I strongly recommend you getting the anterior approach versus the posterior approach. I'm not going to go into much detail because it's not relevant for people who are not considering it. But if you are considering a hip replacement, don't just go to the orthopedic guy that gets recommended to you and has the best reviews, because if that guy only does a posterior approach, you're going to take a hell of a lot longer to recover and rehab than another doctor that does the anterior approach. Currently here in Naples, there's only one doctor that does the anterior approach, and his name's Dr. Zaire. And I highly recommend him because every single person I've ever worked with who has had surgery by him just flies through the rehab. And another good thing about him is he's very conservative. Never met the guy. Here I am plugging him on the podcast, but he's very conservative. He's a no BS kind of guy. You show up on day one and he takes an x-ray and he goes, you're not ready for it. Go tough it out for a little bit longer. So he's a very conservative guy and he gets great results. But anyways, neither here nor there. If you're considering a hip replacement, definitely look into the anterior approach. Avoid the posterior approach like the plague. It's just night and day different now with the technology that they have nowadays. So to come back full circle, if you have hip pathology, you got an x-ray and it shows that you got an arthritic hip, the number one thing that you should be focusing on is squeezing your ass as hard as you can, specifically with straight knees. So in the standing position, you want to think about locking your knees, but you're not locking them passively. You're straightening your knees actively, and then squeeze your ass as hard as you can. As you're squeezing it, you should be squeezing it so hard that you feel a stretch in the front of your hip. If you're not feeling a stretch in the front of your hip, you're either not squeezing your ass hard enough or your knees are not straight enough. So there's a lot of people that think that their knees are straight, but they're really not. And when I tell them you've got to straighten them even more, they're like, oh, I'm going to hyperextend my knee. That's just your own perception because you haven't been there in a while. It's not going to hyperextend when you're doing it actively. You can't do that. Your brain's too smart. It won't allow you to hurt yourself. So squeeze your glutes as hard as you can to straighten your knees. And you should be squeezing so hard that you feel a stretch in the front of your hip. If you don't feel that stretch, you're not squeezing hard enough and or your knees are not straight enough. That is the number one thing you should be doing on your own right now. And just do it as much as you possibly can throughout the day. Stand up, squeeze your glutes, get a standing desk, quit sitting on your ass. Stand up every single commercial. If you're going to watch a show, stand up for the entirety of a commercial and squeeze your glutes. You really got to get the front of that hip opened up and the back of the hip stronger, aka your glutes. And that's what you should be working on as much as you possibly can if you want any chance at all at avoiding a hip replacement, or if you've already had a hip replacement. I can't tell you how many times I've run into clients over the years who have had a hip replacement 6 months or 2 years or 5 years prior, and they're still weak as heck. Like there's no muscle activation around this brand new hip. So that's what's going to cause you to outlive it because you're not using the muscles to support it. So that's my little nugget of gold for you there. Hopefully Jenny and I can get on the same page again next week and we'll be back together. If not, one of the two of us will be here and we will hopefully have you entertained. Don't forget to subscribe to this podcast and share this with somebody. I know somebody's listening to this and has a family member or a friend that is right now considering a hip replacement. Number one, tell them to strongly consider the anterior approach versus the posterior approach. And number two, tell them to get a second opinion. Come to us. I'll tell you in 30 minutes if I think we can save your hip or not, and if we think that you can maintain a high quality of life. I mean, we've had people over the years who are determined to not have a hip replacement, yet their quality of life is diminishing. And I tell those people, I'm like, listen, this is not worth it. Your quality of life is shit right now. Just go get the operation. 6 months later, you'll be really happy that you did it. You're going to get your quality of life back. But neither here nor there. Moving forward, share this with somebody, subscribe to this, email us some questions. I'm going to be going through all the major body parts through this MythBusters. I guess I never explicitly said it on this episode. Myth of the day. Just because you have hip arthritis means that you have to have a hip replacement. False. That is so false. You've got to do certain things, everything that I've talked about for the past 20 minutes. Then once we've exhausted all of those options, then we can start considering the hip replacement. Just because you have hip arthritis does not mean that you are doomed to have a hip replacement. All right. Have a great week. Have a great day. Stand up, straighten those knees, and squeeze your ass, baby. Yeah!
Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenni Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.